Have you ever felt a sudden, worrying tightness in your chest, and your first thought is something seriously wrong with my heart? You're not alone, and often, the answer lies not just in your chest, but in your mind. This powerful link between what we feel and what we think is known as the mind-body connection, and understanding it is the first step to managing one of anxiety's most frightening symptoms. Deep within your brain, you have a highly effective alarm system designed for survival. When your brain perceives a threat, whether it is a real danger or a stressful thought about a work deadline, it triggers the fight or flight response. This system instantly signals your adrenal glands to release a flood of stress hormones, primarily adrenaline and cortisol. These chemicals surge through your bloodstream, acting like an emergency broadcast to the rest of your body, telling it to prepare for immediate, decisive action. This ancient protective mechanism is incredibly efficient, but when it's activated by anxiety, it can lead to some very real and uncomfortable physical sensations. So how does this internal alarm translate to that specific, alarming feeling in your chest? It happens in a few key ways. First, as part of the fight or flight response, your muscles all over your body tense up, ready for action. This includes the intercostal muscles between your ribs. When these muscles tighten, they can create a constricting, squeezing sensation around your rib cage that feels like intense pressure or pain. Second, anxiety often changes your breathing pattern. You might start breathing very quickly and shallowly, a state known as hyperventilation. While it feels like you're not getting enough air, you're actually taking in too much oxygen and expelling too much carbon dioxide. This imbalance can lead to feelings of breathlessness, lightheadedness, and, you guessed it, a distinct tightness or discomfort in your chest. Finally, adrenaline directly impacts your heart. It tells your heart to beat faster and pump more forcefully to send oxygen-rich blood to your major muscles. This sudden increase in heart rate and blood flow, known as palpitations, can be felt as a pounding, fluttering, or racing sensation. While it's a normal part of the stress response, the feeling itself can be a major source of distress. These physical sensations create a vicious cycle. You feel a tightness in your chest, which your brain interprets as a sign of danger, perhaps even a heart attack. This worry triggers even more anxiety, which in turn amplifies the fight or flight response, leading to increased muscle tension, more rapid breathing, and a faster heart rate. This feedback loop, where chest sensations cause worry and worry worsens the sensations, can make the experience escalate quickly, leaving you feeling trapped and frightened. It is crucial to understand the difference between anxiety-related symptoms and a true cardiac emergency. This video is for informational purposes only and is not a substitute for professional medical advice. Common signs of anxiety can include muscle tension, rapid breathing, and a pounding heart. However, classic heart attack symptoms often include crushing chest pain that may spread to the arm, jaw, or back, along with shortness of breath, nausea, and cold sweats. Always consult a medical professional for an accurate diagnosis. If you ever suspect you are having a heart attack, do not hesitate. Seek emergency medical help immediately. Understanding the origin of your chest pain can be empowering. When you recognize it as a symptom of anxiety, you can begin to regain control. Simple techniques, like practicing slow, deep belly breathing, can help deactivate the fight or flight response and calm your nervous system. By consciously slowing your breath, you signal to your brain that the danger has passed, allowing your body to return to a state of calm. If you found this helpful, consider subscribing for more content on health and wellness.